Hi, this is Dr. Terry Frankovich. I'm the health officer for Humboldt County, and I wanted to address some questions that we're hearing about testing. I know it's been a confusing time, and part of that is because I think on the national level, there's a lot of information suggesting that everyone who wants to be tested at this moment in time can be tested. The truth is, we want to have robust testing of people across our communities and across the country, but it actually takes some time to build that capacity, particularly on the front lines. So when you think about it, to do testing, you need a lot of things in place. We need to have, right from the front line, where a provider has to have a swab to put in your nose and throat to test you, to the liquid that they need to put that swab in. They need to be able to transport that specimen somewhere, either to a commercial lab or to our local lab. They need to, at the lab end, they need to have all of the ingredients, components, and trained staff to run the test. All of that does take time, and frankly, people have been putting a lot of time into building that capacity on the front lines in recent weeks. So we know that everyday testing availability is increasing, and that's incredibly important. It will allow us to test a broader group of people and not focus testing strictly on people who either have had travel or contact with a case, but who might have no known contacts with COVID and still have symptoms that are compatible with it. So as that capacity increases, you can expect that testing, even locally here in Humboldt County, will be expanding over the coming days and weeks. Right now, tests can be run by the public health lab, commercial labs, and a small number of healthcare center laboratories that are usually associated with, for instance, academic institutions. So if we talk about commercial labs, as the governor has mentioned, that commercial lab capability has been working again on building capacity. The capacity today is expected to be vastly greater by the end of the week for those labs as they get their operations in place. So what we can expect is that the commercial labs are actually going to be the backbone of lab testing, mainly because public health labs, which are another option for testing, are typically smaller labs that are not built for the volume of testing that we need done during this outbreak. So our lab locally here in Humboldt, while an excellent lab, is a smaller lab. We expect that our capacity for testing will be about 60 samples per day as we are fully operational. What that means is it's not the type of testing capacity that allows for 200 cars at a drive-through testing site, but it is the type of capacity that will allow us to provide what we can do best, which is to provide timely information. Because we're local, we can get a specimen more quickly than a regional lab or a national lab, and we have the ability to turn that test result around more quickly as well. That's incredibly important when we're talking about people who are hospitalized, who are potentially in the ICU, people who are healthcare workers, people living in a skilled nursing facility where there's concerns about contacts with other individuals, workers associated with those entities. Those are all really important groups for us to be able to have an answer, say in 24 hours instead of 72. It will make a huge difference in our response. So while we in public health have been speaking with providers and getting out guidance that says we are now accepting a broader range of patients for testing, we do want to make sure that we have a bit of remaining capacity to test those individuals who are most at risk or will have the most impact on our healthcare system and community. The other entity that can do testing are, at least in the future, will be hospital-based labs. So technologies in development to allow even smaller regional hospitals and hospitals, for instance, in our community, to do testing on site. Similar to what you're able to have done when you get flu testing, that type of thing. As that test capability comes out, obviously it will be much more seamless on the front end and much quicker for people to get their test results. So all of these are components for testing in our community and across the country. And what's important to remember is that while I know on the front end it's frustrating to try and figure out how to access what you need or think needs to be done, a lot of work is going in on the front lines here as well as the national labs to try and improve that access all the time. We'll keep you posted on what's available and strategies for informing you about where to go for testing, how that should be accessed will likely change over time as well. And we'll try and keep you informed on our end so that you know where to go to access the care that you need. For more information about COVID-19, please visit Humboldt Health Alert at humboldtgov.org/Humboldt Health Alert. For medical questions, please contact your healthcare provider. And if you have non-medical questions related to COVID, please call the Community Information Line at 707-441-5000. Thank you.